Okay, so hello everyone. Today we are from SGD B2. Would like to present our student project entitled Ocular Related Problems While Traveling. So this is our group members. We have 12 group members in SGD B2. Without further ado, now we would like to start our presentation. To the person who is in charge, the time is yours.
My name is Vivian Skela with student ID 169. I'm going to explain about the background of our student projects. Currently, people have been traveling, whether it is locally or internationally. And of course, you would want to enjoy your travel to the fullest, so having any form of emergencies while you're away is not an option. Accidents and injuries might happen, and some condition might also lead to permanent vision loss. Facing a new environmental and infection factor, travelers' body are vulnerable. One of our body parts that can be affected is the eyes, and the most common eye disease among travelers is conjunctivitis or pink eyes. In tropical and subtropical destinations, conjunctivitis can be caused by arboviral infections like Zika and also chikungunya. Recreational activities like swimming, scuba diving, and also skydiving also contribute greatly in causing eye disease. Travelers with underlying eye conditions should be more attentive to their eye care to avoid having any further eye complications. And lastly, because 75% of the people around the world wear vision correction products, uh, and most of them also use contact lenses. Contact lens user need to be more attentive to their eye hygiene to avoid any ocular infections. And these are our problem formulations. And this is our objectives. And these are our benefits. That's all from me. Thank you.
Hello, my name is Komang Jaya with my last digit number 037. I would like to continue the presentations according to the definition of our student project. Over the past few decades, traveling today has grown in popularity. Decreased visual acuity, inflammatory or degenerative lesions, chronic disease, and eye trauma are some of the eye diseases that can occur in all traveling tourists. Tourists in tropical climates are at risk for eye disease that are rare in temperate climates such as onchocerciasis, loiasis, genatostomiasis, African trypanosomiasis, or trachoma. Conjunctivitis is the most common eye disease found in tourists. This can occur due to bacterial or viral infections or arboviral infections in tropical areas such as Zika and chikungunya. That is all for me. Thank you.
Hello everyone, my name is Khasandra with my last three name digit is 152, and now I'll be explaining about the travel-related eye infection in travelers. So travelers traveling to endemic countries are at risk of acquiring unique and rare infections which may be unfamiliar to medical practitioners, contributing to delayed management and leading to fatal causes. Traveling that includes water-related activities such as swimming pose high risk for eye infections in travelers such as onchocerciasis, or as we know, the river blindness that is caused by the parasitic worm Onchocerca volvulus and is claimed to be the second leading of blindness caused by infection. This infection is transmitted through the bite of a species of black fly that lives at fast-flowing rivers in Africa. Microfilariae migrates to the cornea surface, causing punctate or sclerosing keratitis as its pathological clinical manifestations. Tropical countries with warm and humid weather, such as Southeast Asia, Africa, and South America, hold a threat both to residents and travelers alike for its endemic infections transmitted through mosquito bites. One of them is dengue fever, which symptoms including retroorbital pain that may progress to permanent visual impairment. The second infection, that is chikungunya, manifests several ocular symptoms as well, such as anterior uveitis, conjunctivitis, and retinitis. The third infection, that is Zika virus infection, causes conjunctivitis with fever and non-purulent or ocular discharge bilaterally or in both eyes. Children infected with cerebral malaria might experience malarial retinopathy as a complication. So that's all from me. The next part will be continued by my friend. Thank you.
Hello everyone, my name is Putu with the last three digit number 103. And now I will continue our group's presentations about ocular related problems while traveling, in which I will discuss about travel adventure activities. While traveling, travelers may perform activities that will put their health at risk. That includes their eye health, which is why I'm going to discuss about several activities related to travel and adventure that may pose threat to eyes health. One of them is high altitude traveling, which might includes high altitude trekking. This is an activity that involves traveling in high altitude, such as mountains, where the traveler may expose their eyes to various dangers such as hypoxia, cold temperatures, ultraviolet radiation, dry wind that may cause the eye to dry up, and various high altitude sickness that may affect the eyes. And in addition to that, there's also activities such as bungee jumping. Bungee jumping is one of extreme sports that is usually done while traveling or in adventure activities, which is popular in several countries such as New Zealand. Bungee jumping may cause injuries to the traveler's eyes by means of sudden increase and decrease of venous pressure, mechanical effects of gravity on the vitreous fluid movement, and even injuries inflicted by the bungee cord itself.
Hello, my name is Gusti Wiweka Frangipani Vedanti with the 3 last digit of my student identification number is 064. Today I'd like to continue the presentation about travel adventure activities. Swimming. Swimming is an activity often done either in a swimming pool or in natural bodies of water, such as rivers or sea. Swimming may expose the eyes to water, which may cause various pathologies grouped together as water-related ocular diseases. Waters exposed to travelers' eyes may contain agents that are either infectious, allergic, or toxic. Next one is surfing. Owing to its nature as an extreme sport, surfing may cause various acute and chronic conditions, including ones that affect the eyes and the orbits. Although infrequent, surfing can cause ocular and orbital trauma, which can happen by mechanisms such as getting hit by a surfboard.
Hello everyone, my name is Nadya Iswari with the last 3 digit student number is 118. Today I would like to explain about the eye at high altitude. High altitude eye problems are often faced by people who travel by airplane, including the pilot and other cabin crew. The same problems may also be experienced by mountaineers and trekkers. Traveling at high altitude can cause ocular pain, which is also called airplane headache. It is due to pressure change, which causes cerebral artery vasodilatation. The diagnostic criteria of airplane headache are severe pain less than 30 minutes at least 2 times during air travel, including unilateral pain, frontal-orbital pain, and stabbing pain. No other symptoms and not associated with other disease or disorders. Analgesic can be given as the prophylaxis of airplane headache. The result of the medicine should be optimal if it is taken 30 minutes before flight. Dry eye is another problem that is also common in high altitudes. The symptoms are blurred vision, burning sensation, red eye, light sensitivity, and the sensation of foreign body is also present. The dry environment in the cabin or other high altitude area, for example mountain, cause lipid layer thinning, less tear production, and higher evaporation of aqueous tear film. Along with the wind and high UV radiation, make the decrement of lubricating tear film coating even worse. Treatment for dry eye is mostly simple by giving tear substitute or eye drops. If there is a high possibility of strong wind and high UV light exposure, it is suggested to wear fitted goggles for travelers. That's it from me. Thank you.
Hello everyone, my name is Jaya with the student number of 2002511211. So today I would like to explain about the eye on low altitude. The low altitude that will be discussed is the underwater environment. It presents several stressors to the eyes, such as the water itself, elevated pressure, low temperatures that will influence the vision, hyperopia, and blurring of the underwater vision. Artificial lighting can be solved the problem of decreased light intensity and color perception with depth. However, the air cornea contact can be restored by simply wearing a face mask, effectively eradicating water-induced hyperopia. So that's all from me. Thank you.
Greetings, I'm Dhiyo and my student identification number is 133. We're going to discuss about UV exposure-related eye disease. Being exposed excessively to ultraviolet radiation or UVR will damage the cornea, lens, and retina. It may also cause eye trauma that can lead to other complications. UVR from sunlight can cause the genesis of reactive oxygen species or ROS in the eye that can damage the neuronal myelin, induce intracellular stress signaling, and cause beta oxidations of lipids components of the eye. One of the most common eye diseases caused by travelers is dry eye disease. By damaging the neuronal myelin, UVR can cause corneal neuropathy, which in turn may lead to the reduction of tear quality and quantity. Added with the beta oxidation of the lipid layer of tear and inflammation caused by the frost, the tear then becomes unstable. This results in the increase of the osmolarity of tear, which further exacerbate the intracellular stress signaling and therefore increasing inflammation, ultimately causing dry eye disease. Damage caused by UVR may also cause several other diseases if it is acquired continuously. A study done by Modernis et al. In 2018 shows both long-term and short-term adverse health effects can be caused by UVR, which are as follows. Short-term exposure may lead to photokeratitis, photoconjunctivitis, and solar retinopathy, while long-term exposure may lead to pterygium, cortical, nuclear, and subcapsular cataract, climatic droplet keratopathy, pinguecula, melanoma, macular degeneration, and corneal and conjunctival squamous cell carcinoma. Thank you.
Okay, so hi everyone. I would like to introduce myself. My name is Tjokorda with the last 3 digits of my student number is 165. And now I will continue the presentation by explaining about the traumatic eye injuries. So in nations like New Zealand, bungee jumping is something that is very quite phenomenal as a destination trip for tourists. Bungee-related ocular damage is thought to be caused by a quick increase in venous pressure caused by the rapid acceleration and deceleration during a jump's short duration. Following a rapid 3G deceleration during a bungee jump, intravenous pressure can rise to more than 100 millimeter Hg, which can cause ophthalmic hemorrhage. The mechanical effect of gravity stress on vitreous movement can potentially cause tractional retinal detachment and accompanying consequences. The bungee cord itself has also caused traumatic ocular damage. Travelers considering a bungee jump should be aware of these potential issues and encouraged to check that bungee service providers follow strict safety rules. To avoid traumatic injury, protective eyewear should also be recommended. So that's all from my presentation. Next material will be presented by my friend. Thank you.
Hello everyone, my name is Yosephina Gracela Taji with last 3 digits student ID number 087, and I will going to explain about travelers with eye disease or pre-existing eye disease. Pre-existing ocular conditions increase susceptibility to several travel-related eye problems and predispose the traveler to complications during international travel. This includes angle closure glaucoma. Glaucoma is a condition that causes damage to the optic nerve that is associated with excessive intraocular pressure, and when the eye is exposed to a hypoxic environment such as high altitude, glaucoma exacerbates insult to the optic nerve. In addition, patients with recent vitreoretinal surgery involving intraocular gas should be strongly advised against air travel because medical gases such as perfluoropropane or sulfur hexafluoride are often used in vitreoretinal surgery. So travelers with underlying eye conditions are strongly advised to make good preparations before traveling, such as not to forget to bring glasses or contact lenses and take all the medicine they need. And that's all from me, and thank you.
My name is Karina, with student number 2002511003, and I will be explaining about contact lens use during traveling. Contact lenses provide huge conveniences over wearing prescription glasses while traveling, but they can come with potential hazards. Wearing contact lenses in the wrong manners can develop some eye problems such as conjunctivitis or pink eye, dry eyes, iris dyes, and even corneal ulcers. To prevent these problems, there are some precautions to take before and during travel. Before traveling, make sure to check the expiry date of the lenses and carry backup supplies. During travel, take the lenses off during activities like showering, swimming, and sleeping to prevent bacteria growth between the lenses. Take notes about the environment of the place you visit. If the air is very dusty or dirty, replace lenses often or use daily disposable lenses. If it is very dry, carry some lubricating eye drops to prevent dry eyes. When you need to take off the lenses, use clean hands and clean tools and do not use lenses for more than 12 hours a day. While storing contact lenses, only use fresh contact solution. Do not rinse with water or used solutions. That is all from me. Thank you.
Greetings everyone, my name is Adiva Buana Pratama. with 3 last digit of study number 146. Today I'm gonna tell you about the conclusion of our student project. So decrease visible acuity, inflammatory or degenerative lesions, continual element or eye trauma are a number of the attention sicknesses that may arise in all journeying tourists. Several journey sports which could pose a hazard to the attention's fitness consists of excessive altitude journey, bungee jumping, swimming, and surfing. High altitude eye troubles are frequently confronted via way of means of folks that journey via ways of means of plane. I think that's all from me.
So that's all our presentation from SGD B2. I hope you enjoy our student project presentation. And we are very sorry if there are any mistakes during our presentation. Thank you so much and have a nice day.